This is about a healthy 31-year-old female who came with acute abdominal pain worsening for the past 2 days, too much after coitus last night. She has a 9-month-old infant. I am giving the transabdominal ultrasound images and she denied to undergo transvaginal study. Please go through the images and think about the findings and the differential diagnosis, and if possible think about the probable diagnosis. There is no history of fever or vomiting, even though she has some nauseating sensation. Think, what's your diagnosis? If you want more time, please pause the video and go back to see the images. Okay, are you ready? Let's go. Immediate eye-catching is the significant circumferential GB wall thickening with pericholecystic fluid. There is no calculi in the gallbladder, there is no dilatation of IHPR, CBD is not looking dilated. Pancreas, spleen and both the kidneys appear unremarkable. Even though the uterus and left ovary are looking normal, there is some fluid collection around the uterus with altered texture of normal sized right ovary in the background of small hemorrhagic cyst in the right ovary. In addition, noted is the tri-layered endometrial thickness of 7.7 mm. So now this looks like a ruptured hemorrhagic corpus luteal cyst in the right ovary. Okay, whether the GB wall thickening is due to the peritoneal spread. Now you look the GB wall thickening, and in addition there is subtle hypoechoic thickening in the perihepatic region beneath the posterior diaphragm. You can see the image with and without the marks. She was negative for dengue and COVID. All the biochemical and hematological markers were unremarkable except mild elevation of ESR with some lymphocytosis. So now the diagnosis is simple and straightforward. We are dealing with immediate luteal phase of menstrual cycle in the background of coitus induced excruciating pain in the abdomen, and she was just 18 days old with the last menstrual period. So this is the 18th day of last menstrual period, and with these findings this indicates the diagnosis of Fitzhugh-Curtis syndrome. Means she is due to inflammation due to the immediate luteal phase of menstrual cycle. We'll talk about the syndrome. Fitzhugh-Curtis syndrome is defined as the inflammation of liver capsule associated with genital tract inflammation or infection. Classically, it is presenting as sharp pleuritic right upper quadrant pain, and it can mimic many other common disorders such as acute cholecystitis and pyelonephritis and hepatitis. Till the last decade, this syndrome has been known as spread of chronic PID extending to inflame the hepatic capsule, giving perihepatitis. But in this decade, more and more symptomatic individuals are diagnosed easily with ultrasound, especially by transvaginal study, with the triad of pelvic inflammation in the background of 1. Free fluid or fluid collection in the pelvis, 2. GB wall thickening with pericholecystic fluid collection, which might or might not be there. Third one is perihepatic inflammation, which is always there pathologically but might not be detected by ultrasound or even CT sometimes. The spectrum of Fitzhugh-Curtis syndrome ranges from mild one, which might happen only once or twice in a lifetime, which needs just conservative management, to severe one, which with complicated chronic PID, pelvic inflammatory disease, dissecting the right upper peritoneum, giving perihepatitis, which might indicate surgical management for the relief. I had put this as quiz though through Google form, and most of the participants had given the diagnosis of acalculous cholecystitis, which might be partially right. First of all, I thank all the participants for the enthusiasm and the support, but I congratulate Dr. Raghavi, who gave the syndrome as the DD. She is the superstar in this quiz. In addition, there are 7 stars who gave most of the findings correctly without mentioning about the syndrome. I congratulate everyone. Thanks a lot. In this channel, more than 40 quizzes have been posted. To see all the quizzes, you can click the blue colored R button here. Then you can go through the video section above, or if you're oriented specifically, you can click the playlist section above. Here each one has separate playlist section to see more videos of the same section, right? Your feedback and comments will be helpful. Please Put your queries in the comment section. Thank you very much. Take care.